setting up a temporary morgue or working closely and putting together a facility that they can use for overflow should the expected surge arrive like we think. So that's really what we've been doing. Just to give you a quick rundown, City Hall remains closed to the public. We are processing tax payments. We are processing applications for permits, all kinds of things like that. You simply just have to call the individual department and somebody will get back to you. Everybody is outfitted with a cell phone and a laptop, and people are working on a remote basis. We certainly don't pretend like your employees to claim that it's exactly the same as being at the office, but we have managed to keep things moving forward. We're assisting Danbury Hospital and our first responders in collecting donations by putting people together and being able to line up influencers to be able to provide specific items that the hospital said, hey, we need these things and can you help? And we'll continue to do that for the foreseeable future. And this Danbury, City of Danbury City Hall, under our Director of Donations, Taylor O'Brien, has become a drop-off point for the community for all kinds of things. In addition to that, Roger Palanzo, our Economic Development Director, has spent time working with individual businesses, talking to them, listening to them. We're going to try and work on getting as much information out as possible about the economic stimulus plan. Understand that it's still new to us, and we're still trying to understand what the heck it is that Congress did, and I suspect that Congress is trying to understand what the heck that it did. We have some ideas. We think we know what the intent is, but we're looking for all kinds of guidance and clarification on specific points. Same thing with the governor. I will tell you that I know Dr. Murphy is serving on a panel for the governor. I remain in literally constant contact with Governor Lamont. He's been very good during this difficult time. I have to give him credit for all the things that he's been doing. And I just got off the phone with him this morning, whether it's a big or small issue. He's been taking advice and also providing assistance to us as we need it. And I think that's what a governor ought to be doing during this difficult time. So we also are having our first city council meeting Tuesday night remotely via Zoom. Guaranteed to be a disaster, but we'll figure it all out and work our way through it. Just the technology piece generally gets people confused, and we'll get it done though. And so we're currently training our council people to use the iPads that we provided for them and how to use the app on Zoom. So what is good is that all our council members are enthusiastic about doing it. It'll just be trying to get them geared up and sensitized to the technology that they have to use. We are delaying our budget process for 1 month as we try to get some clarity on what it's going to look like out there in terms of the business environment and, of course, in terms of public meetings and so forth. You know, we really are, this is a moving target budgetary-wise. We're not sure how we're going to do this given the incredible impact that the shutdown is going to have on all businesses, big, small, and medium, and the time it's going to take to recalibrate and get up and going again. So we are working on that here on a daily basis. With that, I'm going to pitch it back over to PJ. I know Dr. Murphy's here with us. He's been doing an excellent job as well, and I'm so proud of our healthcare professionals and the great people at Danbury Hospital and the work they've been doing. So thanks, PJ.
Excellent. Thank you, Mayor. Appreciate your time and your commitment to the community and the businesses in the greater Danbury area. Next up, we are fortunate and appreciative to have the president and CEO of Nuvance Health join us. And before I introduce him, just to echo the mayor's comments, I want to thank you, Dr. Murphy, not just on behalf of the businesses in our community, but really the community as a whole. The tremendous amount of care and dedication that yourself, along with the entire healthcare employees and volunteers at Nuvance Health that has gone above and beyond to put our community's health and wellness as a top priority now is truly inspiring. So with that, I'd like to welcome Dr. John Murphy to the call.
Thanks, PJ. Thanks very much for having me, and thank you to Mayor Boughton, who certainly has been really incredibly helpful and a phone call away and always ready to access whatever services we need within the city or outside in the state with as many contacts. And you know, the question is always answered with a yes before he hears the details. So I appreciate his support and his leadership. To give you all just a more or less a quick overview of what it looks like here on the front lines, as it were. and then I'm happy to take questions if there are any. As probably many of you know, the number of COVID cases now in the United States has exceeded 225,000 infected individuals. We have more in the US than anywhere in the world. Within the state of Connecticut, we now are approaching, as of this afternoon, just about 3,500 cases. And these are people with confirmed infections. They're not necessarily in the hospital. Fairfield County really is the hot zone. There's no question about it. Most of the cases, about 2/3 of the cases in the state are within Fairfield County, and about 60% of the deaths thus far in the state have occurred in Fairfield County. In the city of Danbury itself, as of an hour ago, there were just about 230 confirmed cases. And then as you look at the surrounding towns, I would say the next most are actually in the city of Ridgefield with 78, and then other towns around it. For instance, Brookfield has about 58. We have been actively testing patients in the communities, as many of you know, with an outpatient lab essentially in the basement of the garage, and you can really drive through and get tested. We've tested thousands of patients, and we have a number of those sites across the network. And just for some perspective, about 25% of the individuals who come up for testing do come back positive. That's actually a significant number. It's higher than we would have predicted because, again, people are supposed to be tested only if they have symptoms. We're not really interested in patients who are not symptomatic. The purpose of the testing is not only to come to an appreciation for what is the burden of illness or of infection in the community, but more importantly, as a public health measure, it's very important that we find out who has the infection so that they can go home and self-isolate for 2 weeks to stop the spread. So that's really and obviously if they're feeling particularly unwell, they can see their physician, or if they're short of breath, come to the hospital. But really it is in large measure to keep them isolated. In terms of the patients who do come into the hospital, we now have more than 100 patients just in Danbury who either have COVID infection or we believe could, and they're called persons under investigation. We treat patients who come in with symptoms that we believe are typical of COVID infection, but the testing, there's still a turnaround time of a couple of days, and we treat them. Now, obviously, we're not always right, and we tend to be a little bit overly aggressive, I think, in suspecting people for COVID infection. But it's very important that they be placed in particular rooms in isolation, and that the staff who take care of them are appropriately gowned up and masked. And as I say, we have a significant number. That number continues to grow day by day. It's equally true in our other hospitals. And I'll get to this in a little bit, are concerned because there is no sign of the infection leveling off or the number of patients who need hospitalization to have leveled off. So the problem continues to grow. The patients that are coming into the hospital are getting great care by our staff. The staff has done an absolutely tremendous job. We are seeing about almost a third of patients who come into the hospital, believe it or not, do need intensive care. Patients get pretty sick pretty quickly, and we have expanded our ICU footprint several times over. We are providing patients with absolutely the latest therapeutic interventions, those that have been found to be effective elsewhere in the world or elsewhere in this country. We are in active and nearly constant communication with colleagues, clinical colleagues around the country, including many in New York, Boston, and out west, and some in Italy as well, through our global health program. So we are offering patients a very contemporary care, and we have had some wonderful survival stories, as you may have read about in the paper. We are also bringing to bear medications that are being researched that are believed to be highly promising. So patients who come here are getting very good care very contemporary care, and they're being cared for by exceptionally competent and well-trained professionals. We are very, really quite proud of them, and not only the physicians and the nurses and the respiratory therapists, but even the environmental services team, the folks that are showing up every day, cleaning the rooms, which, as you know, is very important. They're doing it despite risks to their own health. So I salute them and applaud them, and I know you do as well. With respect to supplies, because you can't really read an article or listen to a news story about this topic without thinking about or hearing about masks and gowns. The reason for that is, as I'm sure you know, this is an infectious disease. It is transmitted by droplets, meaning that the virus lives in particles that we shed when you sneeze or you cough into your hand and then put your hand on a surface. The virus lives for a period of time. So it is very important that we appropriately protect patients themselves from spreading it, and also protecting those who are taking care of them. For the moment, we have an adequate supply of masks, and there are different types of masks depending upon whether the patient is on a ventilator or not, and gowns and gloves. It is a constant source of concern, and we are actively looking to supplement our supply chain or our supplies with appropriate masks, gowns, and gloves. And then the critical issue that I think about most of the day, every day, is the adequacy of our ventilators. Obviously, those patients get top priority. We have, at the moment, more than enough ventilators. And we were fortunate enough in advance of the outbreak, in anticipation of the outbreak, and through the hard work of our foundation office led by Grace Linhart, we did reach out to a number of donors, many of whom continue to come forth, and we're deeply grateful for that. We did purchase a number of ventilators, a couple of dozen ventilators, so that we do stand ready to serve patients who need them. And they are really precious assets. And we continue to treat those patients as priorities. So the way we're looking at surge capacity within the hospitals is patients who need vents get top priority. So we have converted a number of spaces in the hospital that didn't used to be ICUs into ICUs now, whether that's the cath lab or the endoscopy suite or the recovery room. We have outfitted them. We have brought back an old ICU and basically stood it up again. And since there were medical gases in there, and we have repurposed, we have increased our ICU by more than 100% in terms of its capacity, deployed almost all of our ventilators. We're still taking care of ordinary non-COVID infected patients. So our ORs still run, although, as you may have heard and read about, we stopped, I think before anybody in the state, doing elective procedures so that, A, we could preserve our personal protective equipment, which is called PPE, to avoid unnecessary exposure to our work staff, because as you may have heard, we had more than 100 people out on furlough because of potential infection. That number is now fallen by more than 50%. Many of those folks are fortunately back to work. But also we wanted to create bed capacity. And that's the reason that we stopped doing elective surgery. But we still do surgery. I mean, if somebody comes in with a particularly urgent issue or a fracture or needs to have a cancer resected, we are still doing all of that work. We're still taking care of patients who come in with heart attacks and strokes, et cetera. So we have a separate ICU as well as separate units for med-surg beds for people who have no reason to believe that they have COVID infection. And then now we are in some of our hospitals building our third COVID-only ICUs to give you some perspective for the size of the crisis. So once we commit floor space to the ICU, we make sure that they have the appropriate medical gases, oxygen in particular, make sure they have ventilators, make sure they have, they're in isolation and in negative pressure environments. The next concentric circle, if you will, are med-surg beds to be sure that patients who come in who are having trouble and belong in a hospital with COVID infection, that they are appropriately located and provided with necessary care. And particularly, we monitor their oxygen levels very closely to be sure that if they need to be moved to the ICU, we do that as quickly as possible. At the same time, we are trying to identify patients who could leave the hospital but maybe aren't quite ready. Or, for instance, some of the skilled nursing facilities in the community have elected not to take patients back from our hospital, particularly those who have had COVID infections, for reasons we all understand. But that creates some capacity issues internally because now you can't free up those beds. So with the terrific cooperation from the state and the city and WestCon, as well as the governor, we now have, as you probably know, a smaller field hospital that the National Guard put up last week, right behind the hospital where the old emergency department used to be. We can fit 25 patients in there. And now we have a FEMA hospital going up at the O'Neill Center, and we can fit up to about 210, 215 patients in there. We will start in the short term anyway, moving patients who could be discharged but aren't quite ready, moving them to these facilities. At least one of them, we want to do that for individuals who have had COVID so that we're not mixing patients and actually unintentionally spreading the virus. But that's really our MO. Every day, twice a day, we look carefully at the number of patients in the hospital, the number of patients in the ICUs, our ventilator supplies, our masks, gowns, and all other PPE equipment. And then the personnel, do we have enough people who are properly trained to staff the units? So this is very much an active and a dynamic issue. It is absolutely all hands on deck. We have about 30% of our workforce working remotely, as all of you do. As you can imagine and understand, most of our workforce are hands-on, and they are here. We will need volunteers from the community, a whole host of volunteers, I think, in the coming weeks as the surge continues, because there are only so many staff to go around. So we will be putting information up, asking for physicians, nurses, PAs, social workers, EMTs, medical assistants, and clerical staff, et cetera. We're going to need all of that help because we are going to potentially spill out beyond the confines of the hospital into these alternative care sites. But the community has been great. We're deeply appreciative of both the emotional support that you've provided, as well as many who have provided financial support. We're very grateful for what you've done. And maybe I'll stop there, PJ, and just take some questions.
Excellent. Thank you, Dr. Murphy, for that thorough update. Greatly appreciate that. Yeah, we do have time for a couple of questions. You did a tremendous job answering a lot of those, but we do have a couple that were submitted prior to our call. Now, you talked about and at this point, what do you see as the greatest need or challenge for the hospital?
Well, I would say the greatest need, if I only knew what the model was going to predict with some certainty. In other words, it's a little hard. We look at models that predict the surge, and right now, as we plot it every day, it's a pretty steep line, upward sloping line. And we compare ourselves to many countries in the Western Hemisphere, as well as to many states, and particularly to New York City. But it still is dynamic. Capacity is a major concern, that we actually have enough play, and we certainly do right now, and I think we certainly do for the next week. We can put people in inside the hospital and properly staff the beds and have all of the supplies we need. But as this thing picks up, the challenges will be making sure we have an adequate number of ventilators, adequate supplies, and then as we move to alternate care sites, adequate personnel. But we are deeply committed to the mission of the organization, which is to preserve and improve the health of our communities. And we're not sleeping much because we are living that mission like never before. So we're just hoping and praying that when the surge hits, that it does not exceed our capacity. Having said that, I will tell you that we're hoping for the best, but planning for the worst. As Mayor Mark said earlier, the governor has asked me to help lead a health system response team across the state. So just so that you can take some comfort in this, I look at the capacity of every hospital every day, and also particularly in Fairfield County. And I'm on the phone with the governor's staff. I'll be speaking to the governor in a couple hours tonight and reviewing who needs what. So to the extent we were ever to come to a position where we did reach full and we needed to start moving patients, then we would do so. Certainly that's one of the benefits of the network. We are regularly transferring patients and equipment within the 7 hospitals of the network based upon daily needs. But once the network's capacity, if that were ever to happen where we were up to our eyeballs and really needed some additional capacity, we have agreements that are now in place and a high degree of cooperation with other health systems elsewhere in the state. For instance, New Haven County and Hartford County don't have 20% of the volume of infected patients that we have. So we are developing transfer protocols. Last night, for instance, the state got access to the federal stockpile. We got 50 vents, and I worked with the governor's staff last night to distribute those vents to hospitals that were in particular need. And we will continue to monitor this so that we are allocating resources by state. In other words, we think that if we reach capacity, we will look to the eastern part of the state to provide us with resources or capacity if we have to transfer patients. And then similarly, I think the eastern part of the state will experience what we're going through a couple of weeks from now, and then we will reciprocate. So it's a very active and dynamic and statewide plan of attack.
Thank you. Appreciate that. And you referenced in your opening comments some of the support from the local businesses. Can you provide any examples with the businesses assisting with either PPE, food donations, and any other relevant assistance? And sort of additionally, to tack onto that, how can any businesses assist in donating food or supplies? Is there a specific department that they can connect with through the hospital?
Yeah, I think that there's a number of things that I would suggest. In terms of the donations, which we so greatly appreciate, many are doing terrific things. A number of restaurants are supplying us with food. So while we're working hard, we're all gaining weight too. But it's really deeply appreciated. But to the extent that there are unopened, for instance, the bleach wipes or hydrogen peroxide wipes, that would be terrific. We need clean, disposable face masks, gowns. And I think you all realize this. The supply chain was disrupted. Everybody's looking for this stuff. And we started planning for this a couple of months ago, but we have not been able to resupply many of the things that I'm talking about here. Gowns, head covers, gloves, eye shields, face shields, shoe covers, scrubs, all of those things, particularly masks of a whole variety of types, N95s or industrial N95s, and there's a whole host of them. All of those things would be certainly appreciated. Other things, the foundation office is absolutely staffed up and ready to receive in-kind donations or financial donations, and they can be reached at 203-739-7227. That's 739-7227. And there are other, if you check on our webpage, we also have information there. By the way, we posted FAQ, frequently asked questions. If you want, if you go to danburyhospital.org, there's a red banner on that page for frequently asked questions and other current information. We also have set up a community hotline. We've handled well over 6,000 calls, and the numbers on the website. I wish I remembered it here for you, but I can send it to PJ. But if you've got questions, and literally thousands of members of our community do, we have that hotline staffed 6 people at a time, either physicians or nurses, so that the questions are answered by clinically, pretty sophisticated people trying to keep you all informed. And we'll also be launching a web page to ask for, to the extent that there are people who want to volunteer to help, particularly as we start to fill up the O'Neill Center, who it is we're looking for and how they can volunteer. So those are some of the things that we're looking for help on, PJ.
Excellent. Thank you. I appreciate it. So it looks like that's all the time we have for this afternoon. I'd like to thank Mayor Boughton again for joining us, Dr. Murphy as well. Thank you very much. Is much appreciated. So for those that are on the call, please don't forget that the Chamber, we're here to help you during these challenging times. If you or any other businesses out there might have questions regarding any of the recent resources that are being rolled out, please do not hesitate to give us a call. Our number is 203-743-5565, and I promise I'll answer the phone or leave a message, and I will get back to you as soon as possible. We hope to have all of you join us next week for our weekly conference call, Thursday, April 9th. That'll be at 2:30 as well. Thank you again, everyone, for joining us, and please stay safe.